Hello, everybody. My name is Alicia,
And I'm Ernest, and we're with Patient Care Pathway.
and today we are going to be presenting to you burns, the different types, and how to treat them. To start the presentation, we are going to be talking about degrees of burns. Now, first degree burn is a superficial burn that only affects the epidermis layer of the skin, which is the first layer. Now, the causes may be from sunburn, opening a boiling hot water pot, being splashed with hot water, or friction of something rubbing together on your skin. Now, it may appear red, dry, or cracked, as you see in this picture right here.
Now, starting off with second degree burns, they may look wet or moist, and blemishes may develop. They affect the first and second degree layers of the skin, the epidermis and the dermis layer of the skin, as you can see here.
Now, moving on to a more serious type of burn, we have third degree. Now, this completely destroys the epidermis and dermis layer of the skin, which are the first two layers, and it may even reach to underlying muscle layers. Now, since it may reach underneath the muscles and tendons, it may hit a nerve, and you may have no feeling in the area at all. Now, the characteristics of the burn are white, charred, blackened, and no feeling of the area at all, as you see in this picture right here.
Now, starting with the most severe degree of them all is known as the fourth degree burn. It is the most severe burn because it affects all layers of the skin, muscle, tendons, and even in most cases bones. They are very life threatening, as you can see here. Thermal burns are skin injuries that are caused by excessive heat force, such as hot steam, hot liquid, or a hot surface, or even sunburns.
Help! I got splashed with hot water. Do you know how to treat it?
Yes, I do. Now, starting off with the treatment of thermal burns, you want to remove anything that's in the way, such as clothing, jewelry, or cloth. After that, you want to run it under cold or room temp water and make sure it's running so it could cool the burn immediately. But if that's not available to you, you can always use a water bottle. Next, you want to get an over-the-counter medicine such as ibuprofen or Tylenol to give to the person so they can help relieve the pain. Next, you want to get a dressing, apply it lightly to the skin to make sure the blisters underneath don't break. And after that, you want to get tape and just tape it up.
How to treat chemical burns. First, you're going to want to assess the wound and burn area. You are not going to want to use water on a burn if it reacts with water negatively. Instead, you're going to get a dry cloth and dust off the burn. Put a light dressing on it very carefully and tape it around. Do not put any friction on the burn. With electrical burns, first you are going to want to assess the wound burn area. Make sure the person is safe, not next to any metals or liquids. Then you are going to want to see if you can help the person. You're going to want to douse water on any burn infection or area, and you are going to wrap it gently as well as you've seen in previous. If the person is unconscious, you are going to want to start CPR and get an AED and call 911 immediately.
So burns are a very serious medical condition. Many people die from infections.
About 265,000 people die a year from burn infections.
They include shock. Shock is deadly if it's not treated properly. It leads to organ failure, and organ failure could lead to loss of blood flow or oxygen flow as well.
People of shock may have symptoms of heavy breaths, fast breaths, weak pulse or fast pulse, restlessness, aggressiveness, and or nausea and vomiting. To wrap it all up, in this demonstration, we talked about the different types of burns, the different types of degrees, and how to treat them.
Thank you for watching, and I hope you guys learned something out of this demonstration.
Thank you.